Thank you. So we'd like to get a pulse of who's in the room with us, and we do a quick check-in. Kindly in the chat, if you haven't already, enter your name, pronouns, role, and organization. In addition, we'd love for you in one word to describe how you feel about your CHW work. I'll give you all a moment to do that, so we could gauge who's in the room. Thank you for sharing all of where you're representing. And now I'd like to quickly go over the purpose and agenda of this meeting. We are here today to share an update on HCAI's involvement in the joint California Health and Human Services Agency, or CalHHS, the Department of Healthcare Access and Information, us, HCAI, and the Department of Healthcare Services, DHCS's CHWPR Workforce Initiative. We will go over a background on the initiative, a community engagement overview, the key findings, and lastly, the funding framework. And now I will hand it over to Libby Abbott, our esteemed Deputy Director of HCAI's Office of Health Care Workforce Development.
Thanks, Tanielu, and good afternoon, everyone. Glad to be with you all. Very proud, as well as some of you have articulated, to be part of this work. Honored that the state gets to play a role in supporting this great work. And pleased to see such high attendance for today's session. So this has been a long journey for us as HCAI and in partnership with our partners at DHCS and agency, California Health and Human Services. So we're just very glad to be here in this moment where we can share some of our findings, our thinking, and hear from you all. So to start, we have this slide here just to kind of level set and make sure we're all talking about the same sort of workforce. I'm not going to read through the definitions. I think you all know probably better than we do what is a community health worker, promotor, or representative. I think the key point here that we're trying to drive is that we're thinking about this workforce, which is a rather broad and diverse workforce. So we use the umbrella term CHWPR. You'll hear me say that throughout our presentation today. We know that that comprises several different roles, including community health workers, promotores, community health representatives, and others that aren't listed here. We also know that those roles serve a really wide range of communities. They do a wide range of tasks. We have folks who are hospital-based, we have folks who are community-based. There's a full range here. So just want to acknowledge that. And we're really referring to kind of the full umbrella of this workforce when we use the term. Next slide. Okay, so I want to start by kind of getting us all on the same page about the role of the state in supporting the CHWPR workforce, some of this background and the commitment that's been made. So some of this actually predates my arrival at the state all the way back to kind of 2021, 22. In the midst of the pandemic, I think that our leadership at Health and Human Services and in the administration was really blown away by the incredible work that was done by community health workers, promotores, and representatives to support communities during that time, support them to get the right information, to get access to services, to navigate uncertain times, to understand their health options, and to keep them connected to much needed health services, sort of recognizing the incredible role that CHWPR has played in the COVID-19 response and management. The California Health and Human Services Agency, HCAI, which is our Department of Healthcare Access and Information, and the Department of Healthcare Services came together under the banner of an initiative called Workforce for a Healthy California, and agreed that Workforce for a Healthy California needs to include support for the CHWPR workforce. There are two kind of major milestones that kicked off this commitment to supporting the CHWPR workforce. On June 30th of 2022, we as HCAI were charged with developing and implementing statewide certificate program requirements for the CHWPR workforce. And the reason that was because leadership felt that we wanted to support this workforce to professionalized, to be certified, to be officially acknowledged, so that we could amplify the work of the CHWPR workforce and help develop and expand the workforce. that was done in complement with tasking DHCS, the Department of Health Services, to make CHWPR work billable as a service to Medi-Cal. So there's these kind of two pieces that were meant to go together. HCAI will support the professionalization and the development of the workforce through the development of certificate program requirements. At the same time, DHCS. Oh, sorry, if we could just make sure everybody's muted. Thank you. DHCS will support the sort of sustainable financing pathway for this work by establishing CHWPR work as a billable service in Medi-Cal. Both of those things kicked off in mid-22. So for HCAI, following us being tasked with figuring out a statewide certificate program, we then spent the next year, more or less, engaging with community and trying to figure out what that would look like. So we did a broad range of stakeholder engagement, speaking to folks about what a certificate program could or should look like. We looked at what other states were doing, and all of that sort of culminated in what we call the guidance letter, which was issued in July 1, 2023. That is where we outlined what we would propose for a statewide certificate program. So that was responding to what we were tasked with in statute the year before. Following the issuance of that guidance letter, we did hear from folks in the community that we had not perhaps listened as deeply as we could have, that our guidance letter did not address many of the concerns and points of feedback from the community, and there was a request that we revisit stakeholder and community engagement. And so in partnership, again, with agency, California Health and Human Services, and DHCS, we agreed we would pause the implementation of the guidance letter in November of 2023, and we would go back for round 2 of stakeholder engagement and deeper community dialogue. So after that, we did set off on this second round of community engagement. That took us from February to November of 2024. To support us in that process, we established an ad hoc advisory group because we really heard from folks that we needed to stay in touch with community. We wanted support from community members on how we were asking questions, who we were talking to, how we were processing our findings. So that ad hoc advisory group really played a critical role in sort of guiding our second round of community engagement. I'll share more about how many dialogues we had and what we heard. That's kind of the crux of this presentation. But I think in terms of the timeline, it's important to note that while we were in the midst of this second round of community engagement in 2024, the Budget Act of 2024 unfortunately resulted in the reduction of nearly all of the funding that we had for the CHWPR workforce initiative. So we were in process trying to figure out, should we implement a statewide certificate program, and or what should we do with our funds, while those funds unfortunately were retracted because of a very difficult budget year. So we'll come back to that, but I think important to frame that as you're thinking about the timeline or the sequence of events. So we went through the second round of community engagement. We, of course, had this huge curveball in the middle with respect to the Budget Act and the reduction of our funds. At the end of 2024, having completed our second round of community engagement, we established a formal advisory work group. So you'll remember we had been working with an ad hoc advisory group who had given us really excellent feedback. We wanted to open up a formal advisory work group that was open to folks to apply, who would then move forward with us as we digested the findings from the community engagement and moved it into some funding decisions for the funds that did remain. So I mentioned that because of the Budget Act in 2024, we lost most of our funding. We were left with about $12 to $13 million one-time funding. And so we established this formal advisory work group to help us think through that framework. And then from December of last year through March of this year, we iterated on that framework with the advisory work group, and we will present to you kind of the high-level framework that we're moving forward with now. Next slide, please. Okay, So I promised we would talk a little bit more about the community dialogues. We'll share kind of the overview of the process and then, of course, the findings, which is the meat of what we're hoping to present to you today. Next slide. So for the course of 2024, we conducted dialogues across the state. We ultimately conducted 23 sessions that were hosted by 20 different organizations around the state. We did our best to make sure we were reaching organizations that worked with diverse populations. Again, going back to that framing at the beginning, we talked about the CHWPR workforce is very diverse. It serves diverse communities in a diverse set of roles and functions. So we wanted to make sure we were working with organizations and hearing feedback from CHWPRs that worked with Latina communities, African American, justice system involved individuals, those that were engaged in the training system through community colleges. We also wanted to make sure we were reaching the workforce that worked with Asian American, Native American, and Pacific Islander folks, Mesoamerican, Indigenous communities, Native American and tribal groups, and unhoused populations. So really tried to kind of hit all of those. We ultimately had over 680 participants in our dialogues across those 23 sessions. Next slide. I won't read through these, but I think here for your reference, just to show the different host organizations that we worked with. And next slide. Some of these were virtual and some were in person. So we did our best again to enable access to these dialogues by making sure we had in person for folks who wanted to be in face-to-face discussion, and we also had virtual options for those who weren't able to access physically an in-person session. So what was kind of the goal in our set of questions with this dialogue? You'll recall that when we were first tasked with our role in supporting the CHWPR workforce in the middle of 2022, we were given a very specific task. We were asked to figure out what a statewide certificate program should look like. We went about that process, we issued that guidance letter, and then we heard back from folks that again, we needed to listen more deeply and I think more broadly. So we set out to ask a set of questions that was a bit broader than just what should a certificate program look like, and actually get to the core of, is a certificate program what's needed? What else is needed to support and develop this workforce? How should we as a state be supporting you? So we had kind of three broad themes that we were investigating through these dialogues. The first was, what is this workforce and what do you as members of the workforce need to succeed? What skills, knowledge, and resources do you need to be a CHWPR? What kinds of things do you need to attract you to this work and to help you stay in this work? The second theme was around the certificate, but also around an alternative, which was just training programs. So we wanted to ask, is a statewide certificate valuable? What kind of value would that add to you? Would you want to see that move forward? Yes, no, and why or why not? Would alternatively state funding for training opportunities serve the same purpose? Give you the knowledge, skills, and resources that you need to perform your jobs as CHWPRs, give you the professional development opportunities you might be looking for. If yes, why? If no, why not? And then what are the other things you think we should be thinking about, or the options you think we should be weighing? And that kind of got us to the third theme, which is the biggest kind of bottom line question, which is with our funds, and you'll recall that set of funds got a lot smaller over the course of this dialogue. With our remaining funds and ultimately limited funds, how do we best use them? How should we prioritize based on your feedback? Next slide, please. So that's the outline of what we set out to do in that dialogue process in 2024, and now we're going to share what some of the key findings and insights were that came out of that process. Next slide, please. So we'll move through this theme by theme. The first theme that we outlined was sort of, what do you need? What does the workforce need to succeed? And what would help you stay in this work? We heard a lot of feedback from the workforce that folks wanted training in leadership, in sort of soft skills like patient communication or client communication, and some of the skills they need to be successful in the current landscape, which includes digital navigation and navigating health systems. We also heard that folks wanted specialty content training. So that's the third bullet here. We heard all kinds of ideas, but some of the common suggestions were around new and emerging areas where CHWPRs wanted more training and more support to be able to meet the needs of the populations that they're serving. That includes behavioral health, navigating disability services and connecting that to health services, street medicine, and working with unhoused populations and the impacts of climate change. And then finally, an important theme that we heard again and again, going back to one more to theme one, is that folks needed material supports to be able to do this work. So they wanted to be paid well. They wanted supports for things like childcare and transportation, the things that allow them to do their jobs. We certainly heard being a CHWPR is an incredibly time-intensive job, and folks need the sort of material support and the flexibility to be able to do the work that really defines the crux of the model, which is being out in the community and making time for the people they work with. Next slide, please. Sharing here just a couple of examples of quotes from the different dialogues that we heard about theme one, and it really resonates with what I just described, so I won't necessarily read through all of them. I'll just highlight this first one. That CHWPRs were asking for support for trauma response and mental health for themselves. So this is also a theme we heard. So in addition to material supports, folks wanted support for themselves as workers, acknowledging that they carry a heavy load in supporting historically disenfranchised communities and helping them navigate difficult systems. Next slide, please. So theme two, as I described earlier, was really looking directly at the question of would a statewide certificate add value? If not, what are the alternatives that might add value? And how did folks feel about that? I want to highlight here on this question that we got really mixed responses on this. And our high-level takeaway on this is there's no consensus on the question of a statewide certificate for individual CHWPRs. Some folks felt that a certificate could really help with their own career growth and professional development. It would help bring respect to the profession and professionalize the work of CHWPRs, and it could give them more job options. As the job landscape changes for this work, having an unofficial state-issued certificate might help with that. On the other hand, we heard from others that it might exclude folks who have been doing this work for a really long time without the need for a statewide certificate, that those folks might not have access to or be inclined to or excel in a classroom or a formal certificate setting, and they wanted to make sure that part of the workforce wasn't left behind. And then there did seem to be sort of common ground agreement that if a certificate was to move forward, it needed to fit a few criteria. It needed to be low cost or free. It needed to really prioritize training from the folks who have done the work and have the lived experience as CHWPR and as folks in the community, that it needed to remain a community-rooted training and certification approach. And then it needed to be accessible. And that was both in terms of language and format, thinking about hybrid, in-person, and virtual formats to allow as many folks as possible to access. So again, just sharing some of the quotes from the really rich dialogues we had on this subject. Again, it sort of touches on all the themes I just described, so I won't read through them, but I think just interesting to see this tension that was coming up regularly around, on the one hand, credibility, validation, and professional opportunity, and on the other hand, concerns around leaving folks behind and potentially changing the nature of what it means to be a CHWPR. Next slide. Okay, so the second part of theme two, we asked first about the certificate, but in our early dialogues, we kind of started to hear that people were conflating the concept of a certificate with a training opportunity. So we asked a second question around, would just more training opportunities help solve some of these problems that you're describing for us? And there was overall, I would say, pretty strong support for additional training and professional development opportunities for this workforce. Folks felt that they wanted training that, again, that was community-based, flexible, accessible, some of the themes we just talked about in the context of a certificate. Again, they highlighted specific training areas they might be interested in, content areas, as well as skills around providing trauma-informed care, using technology, public speaking, etc. And then again, this point around accessibility, making sure that training is available to folks in different languages and different literacy levels and in different formats. Next slide, please. Okay, sharing again some of these quotes that hopefully you'll get a chance to go back and read. Again, lots of really rich information here, but just hitting on some of the themes we've already touched on, which is community and locally based, accessible, and relevant to the needs of the communities that they serve. Next slide. So all of this brought us in our dialogues to the third theme, which is, okay, so we've heard from you what your greatest needs are in the workforce. We've heard what kind of supports you need. We've heard your thoughts on training and certificates. Where should we focus? By the end of our dialogue process, as I described, we had pretty limited funding, $12 to $13 million. So it became all the more important for us to ask folks how they wanted us to prioritize. So we heard a couple of things on prioritization and where we should focus our budget. Number one, folks wanted community-led training and growth opportunities that allowed them as CHWPRs to grow professionally, to expand their employment opportunities, to become stronger in the work that they already do. We again heard a really strong call for these kinds of material supports, like housing, childcare, and even mental health and behavioral health services for the workers themselves, right? This idea that they carry a lot of secondary trauma and issues in supporting these communities. We also heard folks sort of talk about the need for work, whether that's done by the state or otherwise, to raise awareness of what a CHWPR is, to really lift up that role and its potential and its impact, and that's important as we think about the long-term sort of trajectory of this workforce and the real potential they have to support our goals as a state and our commitment to health for all. And then finally, there's a real call for thinking through sustainability and organizational development, recognizing that many of the organizations that have been supporting and employing and deploying CHWPRs for a long time have lived grant to grant, and might be smaller CBOs that need support to think about how to expand, how to tap into the Medi-Cal benefit, and how to make sure they can sustain themselves as organizations over time and the workforces that they work with. Next slide, please. And again, I'll leave these quotes for you all to review. Next slide. So we wanted to kind of turn that into what we walked away with as our insights, our key takeaways and insights from this process. And I'll note this is a combination of what we heard in the dialogues, and then also the conversations we were having with our ad hoc advisory work group, who were helping us make sense of what we were hearing throughout the process. So these were some of our takeaways. Number one, we should think about supporting flexible training opportunities across the state. There seemed to be general agreement that this would be beneficial for the workforce. We heard that on this question of a certificate, it should only happen if it can be inclusive, if it would not leave folks behind, and if it would meet certain criteria for sort of what is considered a valid training or background for a CHWPR that doesn't change the nature of the work that they do. We also heard that whether it's training or certificate that we pursue, that it needs to really be community rooted. It needs to draw on the experience of professionals who've been doing the work for a long time in the communities and remain sort of anchored to those communities. We of course we took away this point around accessibility, which came up a number of times. Training and any other offerings needs to be available in multiple languages, in communities that might not have as great of access, including rural areas, and in hybrid formats that allow folks to access kind of flexibly and based on their resources and their time. And then last takeaway here is this point around support for the well-being of the workforce themselves. Next slide, please. So I mentioned that we worked really closely with an ad hoc advisory work group that helped us kind of both shape how we approached the community dialogue, but also how we interpreted or made sense of what we heard in that process. And I think two key points that we'll lift up here that came through really strongly from the ad hoc group. Number one, many of the organizations that employ and support CHWPRs were having a difficult time figuring out how to tap into and navigate the Medi-Cal CHW benefit. So we were very fortunate, of course, to have DHCS in the working group on this initiative. And they were able to help us understand what kinds of resources they were offering. They heard this feedback from the community, and they continue to provide technical assistance to organizations to try to address this. But keep this in mind, because this will show up when we talk about our funding framework and where we ultimately decided to put our funds. The second key point, I think, which was really important was, as you recall, we heard mixed feedback about the question of whether we should roll out an individual level certificate, but the ad hoc advisory group was very supportive of the idea of rolling out a program accreditation function. So what that means is instead of certifying individuals as CHWPRs, we could accredit the organization's CBOs and training programs that historically have trained these folks, credit them as valid trainers, and they in turn can train the prepared workforce. So there was a lot of support for that idea of program accreditation over individual certificates. Next slide, please. All right, so that is the summary of what we learned from our dialogue process and our engagement with the ad hoc group. As I described in the timeline, we then took that information, we stood up our formal advisory work group, and we started turning that into a funding framework. What should we do with our remaining funds? So I'm going to describe to you now what that funding framework looks like. So I want to reiterate this point. I've mentioned it a few times, but important to note, when we set out on our round 2 community dialogues, we had significant funds to support this workforce and to consider the prospect of a statewide certificate function. By the end of the Budget Act of 2024, we remained with about $12 to $13 million in one-time funds, and that is not enough money to stand up a certificate or a program accreditation function. That's because both of those functions are ongoing functions that we would need to implement indefinitely. $12 to $13 million, not enough for us to be able to stand up a comprehensive accreditation or certification function and maintain it over time. So with that in mind, we ran some initial ideas through our ad hoc group, then we stood up our formal group and we ran a draft framework through them in December of 2024. And then we started to iterate until we landed on what is now our 4-pillar framework for our remaining $12 to $13 million funds. Next slide. So I'm going to walk you through the 4 pillars, and this is kind of, I guess, the sort of the meat of where we are. So we wanted to make sure you understood the takeaways from the engagement process, but this is the best description of where we are now and where we're headed. So I want to make sure this is very clear. So 4 pillars that we're focusing on going forward. Pillar number 1, we refer to as the immigrant community health and resilience pillar. And this is, this pillar emerged really due to timing. So you'll recall in the timeline, I said we closed our engagement process in November of 2024, and we started iterating on our funding framework. That was at the same time that the federal administration was looking to change, and we started hearing a lot from the new incoming administration about increased immigration action. CHWPRs, as I've said before, serve a wide range of communities. There is a long and strong history of CHWPRs serving immigrant communities in California. And so one of the things we started thinking about was how can we support this workforce to help immigrant communities navigate these very uncertain and difficult times. We wanted to meet the moment, be responsive to the increased sort of rhetoric from the federal administration and now action. Now here we are mid through 2025. We've seen, of course, lots of that translated into significant action. So we wanted to think about how we can learn the lessons that we did from COVID-19, which is this is the workforce that will do the work, and the state needs to get behind and support and amplify the work of the workforce who will help these communities. So ultimately, Pillar 1 is about leveraging and supporting the CHWPR workforce who are trusted community members to support and engage immigrant communities on a number of fronts. Number one, we want to make sure that those communities continue to access healthcare and are encouraged and supported to continue to do so. Number two, we know that they're facing increased mental health issues like anxiety and even more severe issues as they're navigating these very difficult and scary times. Number three, we know that historically as a state, we've sort of been siloed. We have health services, we have social services, which includes legal services, we have education. We wanted to think about how can we leverage this really powerful workforce. The CHWPR workforce is unique in that way to try to connect some of those dots. So the third piece of this is trying to make sure there's cross-referral and there's coordination between what we're doing on the health side and then making sure these same communities are getting served and connected to legal services as needed, for example, and that their children are getting support with access to education services, et cetera. So there's a concept here around cross-sectoral coordination. So that's pillar number one. Pillar number two, I think, is the most kind of closely mapped to what we learned and took away from both the dialogue process and our engagement with the ad hoc advisory group. And that's this recognition that the organizations that have been training, employing, and supporting CHWPRs for decades need a sustainability pathway, and they need a way to tap into the Medi-Cal benefit. They need a way to connect with managed care plans. They need a way to make sure that the incredible work that's done by CHWPRs is sustainable beyond living grant to grant. And with our very minimal funds, we thought about using that essentially to do organizational capacity building for these organizations, making sure that they can build their Medi-Cal billing infrastructure, that they have the tools and supports they need to train and support their workforce as needed. I want to highlight that an important part of this that was brought to us by both of our advisory work groups was that organizational capacity building is important. And you'll recall we heard that both in the dialogues and from our advisory groups, but also that we need to make sure funds are getting to the CHWPRs themselves. So there's a component of this pillar where we're leveraging an existing grant program called the Amplifying Impact Initiative. But we've added a component there to make sure that parts of the funds that go to each organization are encouraged to be used directly to support the workforce, whether that's through stipends or funded internships or childcare costs, whatever it might be. So we're trying to sort of bring these two pieces together in that pillar. Okay. Pillars 3 and 4. We talk about them as being part of our funding framework, but I want to highlight here, they're not getting any direct funds from HCAI. So of the 12 to 13 million, we will apportion that between Pillar 1 and Pillar 2. Pillars 3 and 4 are kind of more technical pieces that we're implementing at the encouragement of our advisory work groups to make sure that we're supporting this space as best we can. So Pillar 3 is around producing training program resources. So our advisory work groups heard us loud and clear that we no longer had the funding to implement either a statewide certificate or a program accreditation function. But they said, if you can't do that, can you at least help provide some guidance to the CBOs that are trying to train and develop their workforces on what is a core set of good practices around CHWPR training? How does that connect to the Medi-Cal benefit? How do we make sure we're training and supporting and preparing our workforce to tap into that sustainability path? So we're going to work collaboratively with DHCS and some consultants to try to issue some guidance that CBOs and other entities can use to sort of shape their training programs in the absence of a formal accreditation function. The fourth and final pillar was also a suggestion from our advisory groups and a great one. Essentially, they said, okay, again, we hear that you can't do a program accreditation function now, even though that's what we think is needed. Can you at least build a roadmap for what that will look like if and when you get resources in the future? what they said to us, and I think this is absolutely fair, is you've been talking to the community for 2 years now, and you still can't implement this function. Let's make sure that if you get the money in the future, you don't come back to us for a third round of engagement. And I think that's 100% fair. So we appreciate that push that we got from the community, and we are again working in close collaboration with DHCS and a team of consultants to help us outline and have this in our back pockets. What would an accreditation function look like? What would the roles and responsibilities be? How would we implement it, et cetera? And the goal here is to make sure we're going to run it through and iterate it with our advisory work group so that if we do get resources for this in the future, we're ready to go. We are ready to hit the go button, and we don't have to go back for further consultation. Okay. So I'm going to outline some steps ahead, and then I think I'm going to suggest that we take a quick break to let folks just digest and think about your questions before we open it up for further discussion. So I'll walk through a few more slides. Want to outline our next steps. So again, underscoring that we will not be implementing a statewide certificate program. I know that's been a point of confusion in the space, but we're here to say it as many times and as clearly as we can, and we're also communicating it through other platforms so we can try to lessen some of that confusion and ambiguity. We are moving forward with our 4-pillar framework. It has worked through our advisory work group. We've taken a lot of their feedback into account. We feel good about the future direction. Pillars 1 and Pillars 2, we expect to have funding opportunities launching in Q2 or early Q3, with awards being made around Q3 of this year. And then we've begun the work to sort of shape what Pillar 3 we've begun the Pillar 3 work, which includes trying to figure out what the statewide training guidance and resources can look like. That will be a heavily consultative process. We have a team of community-rooted consultants who are supporting this. We will be doing extensive consultation with organizations, and again, we will iterate it through our advisory work group to make sure they're comfortable with the direction that we're heading. And then we believe that Pillar 3 will take us through the end of this year, and Pillar 4 will start early next calendar year. Next slide. I think now is a good time for us to take maybe a 5-minute break, give folks time to digest, and then we can get into the discussion. Okay, thanks so much for those comments. Something I do want to address, because I don't think I spoke to it earlier in my voiceover. Amplifying Impact is a program that already existed. It was initially funded by the California Healthcare Foundation. It had very similar goals to what we identified as relevant and appropriate goals coming out of our dialogue process. So we sort of independently came up with this idea of we want to be able to support organizations to tap into Medi-Cal and develop their workforces. And then we realized there's a program that does that. So we're essentially channeling our funds to support that Amplifying Impact initiative to expand its reach to allow for new applicants as well as additional funds to existing awardees. And as I mentioned, making sure that some of the funds that we provide will go directly to workforce and not just to organizations. So some important details that I may not have addressed earlier that I want to make sure everyone understands. Okay. Lots of great questions. I know it's also a lot of information. So we'll just give a minute or two for any more to pop into the chat. Hopefully we've hit on most of the key questions. And if there aren't any further questions, we can definitely end early. I saw that we shared the inbox in the chat, and folks can reach out to that to get on our listserv, make sure you're getting up-to-date information about our way forward. We will be sharing the progress of the 4 pillars and our work with the advisory work group through that platform. Well, thank you everyone for your time, for hanging with us in this long journey. It's been several years. We've learned a lot. We are excited about what we're able to do with our remaining funds. We know there's a lot more work to be done. We're glad to be engaging with all of you through this platform and with our advisory work group. And we look forward to continued engagement. So thanks everyone. Be well. We appreciate your time.